Good afternoon, all dignitary and my colleagues. Uh, as an orthopedic surgeon, so I mostly believe in bones, not in medicine and everything. And I like surgery, but surgery is not a complete treatment for bone disease. So we have to talk about some medical part also. So let's discuss what is the peak bone mass, calcium and vitamin D, other nutrients and dietary factors which affect the bone health, bone loss, and osteoporosis. Actually, the topic is very big, so we will roam around these 4 or 5 topics or 4 or 5 um, topics for the discussion. So, what is peak bone mass and when it is happen in our uh, daily routine life? So, what is peak bone mass? It is basically bone mineral density which we count as a peak bone mass, and it is also known as bone quality. And also sometime with some study we also take it as a bone loss. And it is mostly, if you think about BMD, that it is directly related to the bone fractures, mostly IT fracture, wrist fracture, and your spine fracture. So there are a number of studies which has peak bone mass age, this its prevalence, etiology changes. We are not discussing here, but we have to know about peak bone mass. There's some quotation about the Professor Charles Dand, which told that osteoporosis is not a old disease; it disease of pediatric population. Why? Because if you are saying that some people is become aging or old, it is not right. The patient become, or the man or woman become old from the intrauterine life, like from the ovary. If you are talking about some patient's entity, it is the aging start from the ovary itself. So the osteoporosis start from the infancy, and it aggravated by the nutrition, bone health, exercises, and other disease or metabolic disorders. So we start from the infancy, or the peak bone mass is the maximum bone mass achieved in the life, and it is always directed toward a healthy lifestyle during the bone forming years, particularly adolescence. Though after infancy, if you are free from any metabolic disorder or other disorder, then it's come to the adolescence age. And these are nutrition, physical activity, and factors which I already mentioned. So good nutrition with particular attention to calcium and vitamin D intake is very important for all the children, and in particular growing age. Bone growing age is there are 2 or 3 spurts in the life. First in infancy, around 3 up to 3 year old. Then it is around 10 year, and the puberty. There are 3 stages which we can found bone spurt. Then physical activity, we have to start physical activity from the very beginning and every phase, like in every age from the infancy to the old age. Then body weight, as you can see in the number of literature that in developing country or even in developed country, in US and Europe, there is increased obesity and mobility nowadays. Then the lifestyle, mostly which is handy, like alcohol and smoking. These both are handy things we can carry out everywhere in our pocket, in our luggage. So these smoking and alcohol are worst thing for the bone health. Then second thing, calcium and vitamin D. It's a very controversial topic that calcium and vitamin D is very important for the bone health. But it is not controversial, it is required. But like in osteoporosis, that means if the osteoporosis is confirmed, then it is not the single role of the calcium vitamin D. You have to take other thing also. So what is calcium vitamin D? These are the key component of bone, and it is in mineralized form in the bone. So up to 9 to 18 years of age should consume approximately 1300 milligram of calcium daily. But it is not right because 1300 is not pure form. You have to take calcium in the pure form or different form which is digestible. So it is not rightly saying that 1300 mg is adequate. So sometimes we have to take 2 gram also. Then adequate vitamin D for the metabolism of this calcium. So it is 600 internal unit, but again it is not 600. It depends on the body form, body growth, other disease, other metabolic disorders, and the enzymes level of the body. So I already discussed this thing. So if the patient has like nephrotic syndrome, it is not the same treatment which can be given with vitamin D or calcium. You have to modify the drugs. So it depends upon the body metabolism of calcium and vitamin D. So always uh, plan calcium and vitamin D according to your body and your physical condition. This is peak age of the bone growth, 9 to 13 year old and 14 to 80 year old. And the daily intake is like equal. So it is around 1 to 2 gram of calcium which can be given in these ages, 1 to 2 gram. And upper level is 3 gram. Up to 3 gram you can take easily without any side effect. But if there is some geoparadise in your kidney or liver or something chronic disease, then you have to be measure these calcium vitamin D accordingly. There are number of trials which shows the use or benefit of these things. But in my practice, if there is some other disorder, there is no benefit of calcium vitamin D alone. So you have to be search out the primary pathology of the bone health, bone disease. Mostly trial evaluate short-term supplementation in healthy children who did not have inadequate dietary intake of calcium vitamin D, and there is good effect. But in longer study, it is very important if longer follow-up. If you are giving calcium vitamin D in proper under controlled way, obviously it is good for the bone mineralization and the fracture prevention. So in India or in worldwide, we are getting old earlier and our longevity is increased. So the old age is increasing and the young age is decreasing. Our average lifetime, I think lifespan is equal or not increasing, but our old age is increasing. So it is very important for the long-term follow-up. Then the body mineral content in children and adult, it is different. So we have to take calcium vitamin D separately for the both. Some random trials evaluate these things. So the doses of calcium and vitamin D is different. It is range. Again, there is some study which includes calcium supplement in 300 to 1200 milligram daily for the 0.7 to 7 year, and no difference in BMD. So calcium vitamin D alone, it doesn't affect the BMD directly. If there is some disorder or some problem, you have to take care of that disorder. And the second thing is physical exercises. If there is no physical activity, these drugs are not effective. Other study which also same the conclusion or meta-analysis, there is no difference in total BMD for the hip, forearm, and lumbar spine in children, which are undergone treatment of calcium and vitamin D. So along the calcium vitamin D, we have to take care of other thing also. There are a number of supplement or number of sources of food which can be used for calcium. But it depends on your food habits and your social stigmas. Like in India, we are vegetarian or some Jain food. They have to take number of foods for the calcium. But yogurt plain, yogurt fruit flavored, this canned milk non-fat, cheese, collard greens cooked, cheese Swiss, and some fish, tofu, soft. There are a number of things which can be used for the calcium, but mostly calcium come from the vegetarian food, which is not digestible properly to all people. There is good thing in India like sesame seeds, which can be easily consumable, and it has good amount of calcium. Even 1 tablespoon of tea, it contains around 37 milligram, 88 milligram calcium. So sesame food seeds are very easily available. We can use it by dietitian opinion, with dietitian opinion. You can see in a single unit per 100 gram calcium available and bioavailability. Actually 60% is the bioavailability of this calcium. So you can take sesame seeds. The second thing, calcium absorption, like I already told that vitamin D is very important for the calcium absorption. So you have to carry out about these calcium absorption. So you have to take care of kidney liver, and your intestine. The three things which is very important for the calcium absorption. The vitamin D is 4,000 international per day, is average for the all the persons in average age and weight. To vitamin D, there are a number of guidelines which include World Health, WHO, International Osteoporosis Foundation, Institute of Medicine, Endocrine Society, American Association of the Clinical Endocrinologist, European Association, and these conclude that the terms of desirable 25 hydroxy D level means vitamin D which is absorbable state set at 30 nanogram per ml and 20 nanogram per ml. So you have to take recommend dose between the 600 and 800 for the international osteoporosis and 600 to 2000 by the European Society. So it is around 800 to 1200. You can take this type of dose or supplement. But again, there is different target population. So it depends on variation there around the mean like race, calcium intake, renal functions, body mass index, polymorphism, key protein. So there is no fixed dose of vitamin D and calcium. So vitamin D also you have to evaluate according to your variation of these things like your ethnicity, race, what is your foods and calcium intake. If you are not taking proper calcium, there is no role of vitamin D to mobilize it. Then individualized requirement for the vitamin D supplementation. So there are a number of things like sunlight exposure, skin pigmentation, baseline vitamin D level, intestinal absorption rates, age, type of vitamin supplement, genetic variation. So there are a number of things which can be accommodated for the vitamin D absorption. Like in India, we are not exposing sunlight nowadays because the sunlight is very sharp or very not good for the sun for roaming around. But in foreign country or where the temperature is not much more, they expose themselves in sunlight. So in India, you have to take some kind of supplement in spite of sunlight. This is some theoretical, what is the levels of blood or vitamin D. I'm not going thoroughly. Then source of vitamin D. Again, the salmon pink. Actually, vitamin D is fat soluble, so mostly non-vegetarian origin. So salmon, mackerel, canned milk, milk with fat, milk non-fat, cornflakes, and cereals, some cereals. So we can get some good vitamin D in these foods product. Then other nutrition, these are the most common calcium and vitamin, and then other nutrition which also affect the bone health, like vitamin K. Dose is 120 microgram per day for man and 90 microgram per day for women. And this is basically enzyme. It acts as an enzyme. So used in body for the different metabolic activity of the absorption of vitamin D and calcium and other things. So we can get easily vitamin K from the green leafy vegetables, spinach, collard greens, lettuce, and scallions. So these are very easily available in India also. So we have to take vitamin K with the other supplement. Again, source is turnip greens, broccoli, Brussels sprouts, spinach leaf, lettuce, cabbage, soybean. So it is mostly vegetable origin. So vitamin K we can get from the vegetable origin. But mostly people are nowadays not in favor of the green vegetables. So this is the vitamin K deficiency also in growing age and old age. Then phosphorus, it can be get by the milk, meats, eggs, legumes. And in processed food as a food additive, nowadays we also include number of foods which has phosphorus. In soft drink, it is in phosphoric acid. So phosphorus is also good for the bone health. Actually, it is also like a enzymic activity. Then magnesium, dose is not actually 350 milligram per day, but it can be varied. Source is green leafy vegetables, whole grains, seeds, nuts, seafoods, beans, and some dairy products. Source of magnesium you can tail mix with chocolate chips, nuts and seeds, spinach, beans, black, no, muffin oat bran, beans, navy, rice brown. It is also vegetable origin. So magnesium we can also get from the vegetable origin. What is the side effect, or what is the, if you are taking more magnesium than the normal, then it can cause diarrhea, nausea, cramps, dehydration, and acid bed imbalance. So it is mostly affect the muscles and the muscular system through the intestine. So if your kidney is not going proper, so there is hypermagnesemia. And if you are not taking proper, or your digestion is not proper for magnesium, then you can get hypocalcemia, osteoporosis, heart diseases, high blood pressure, and type 2 diabetes. But these are not single factors, they are number of factors for that, the disease. Then the lifestyle, nowadays we are taking carbonated soft drinks. So it is not good for the bone health. It actually displays the more nutrient from the body, and daily intake of calcium is increased or reverse. So the carbonated drinks are not good for the digestion of the calcium vitamin D. Then high soft drink consumption in the adolescents population contribute to the low calcium intake, because we are not taking proper food if you are taking the junk food and these drinks. Like calcium and iron are not additive effect. So like if you are taking calcium and iron along with milk, so it is not digestible. So like soft drink or cold drink we are using, it is reverse of calcium intake, because it decreases the absorption of calcium due to some antacid effect or some kind of acidity, or the different kind of acidity which is not required for the digestion of this food. Then phosphorus viability is also, the drinks affect very much. And in old age, if you are taking soft drinks or these kind of drinks, it is affected much more than the adolescence. So if you are getting old, then you have to leave these drinks. Means if you are getting pain, muscular pain and body parts pain, then you have to leave these kind of drinks. Then caffeine intake, it is very common, like in form of coffee, tea, when. So in India, we have a habit to take coffee and tea very frequently. It also deteriorates the BMD. So direct effect, it has both effect, direct and indirect. So direct effect, it also affects the absorption, and indirect, it also displays the good habits, good diets. Then high acid or alkaline diets, which include in protein, dairy and grains, increase calcium excretion. So if your body fluids are alkaline, so it is good for bone health. But if you're getting more acidity in your food, or like high acid, then it is not good. So you have to maintain your pH in your body fluids with the adequate intake of these diets like protein, dairy, and grains. So you can't intake inadvertently. You have to take these with proper guidance. So these are some food which have effect on the BMD and your bone health. This is dark leaf vegetables is very good for the bone health if you are vegetarian. Then bone loss is also indirectly the not growing bone or properly health of bone. So bone loss. Nowadays bone loss is very important. Like we have a tool, which is fracture related tool for the osteoporotic bone. So it is used for the prevention of osteoporosis, and the pyramid shape of osteoporosis, the peak is the fracture, or which start from nutrition, physical activity, and the fall prevention. So it is some preventive part of CFM department. So bone loss is also a measurement. So we have to take out physical activity, food, and pharmacotherapy. There's a number of things which affect the bone loss. There are a number of factors which is underlying diseases, hormone diseases, age, body weight, calcium, vitamin D intake, physical activity, family history, alcohol consumption, cigarette smoking. They are common factors which can be found anywhere, any age group. Osteoporosis is very common and very wide topic, but I am not taking more time for this thing. But it directly measured by the BMD or your other things which have DEXA scan and dual nowadays ultrasound guided scan also, CT guided scan also. You can measure the osteoporosis measurement. So there are number of things which have definition is the WHO definition is that osteoporosis decrease in the bone mass 50% and the bone quality 50%. And there are number of measurement like BMD and Z score and T score. But it also affected by the other thing also. Like this is mostly in the aging population. In like there's bone disease, like metabolic disease. You can't predict the osteoporosis by this definition. If there is minus 1.1 T score, or is osteopenia in normal population, but in metabolic disease it is osteoporosis because there are number of things also. So there are number of factors for osteoporosis. Lifestyle and osteoporosis, it is very important. We are only treating the pain and the calcium deficiency, but not the muscle deficiency. So inactivity is most common cause for the osteoporosis, inactivity. So nutrition, physical activity, which is functional activity actually, by your weight also itself, and smoking cessation or alcohol cessation and fall prevention. It is very important, like you have to take your eyes. If you have cataract or something, blood vision in eyes, so you have to prevent it also. And if you have uneven surfaces in your house or your park or whenever you are consuming your time, so you have to be taken care of these also. So it comes in under fall prevention. Again, for osteoporosis, calcium, vitamin D, fruit, vegetables, protein diet, then hormonal imbalance treatment, sodium, and number of things. So again, you have to be take care of all the elements along with not only calcium, vitamin D, combined calcium up to 1.2 gram, vitamin D up to 800 international unit can give for the as a regime for the normal population. Again, the osteoporosis is old age disease, so there is a number of documentation for up to over the 50-year, up to 70-year-old people, and it is around 800 to 1,200. You can average, you can take 1 gram. You can take 1 gram of calcium and 400 milligrams of vitamin D daily basis. Take home message: peak bone mass and bone loss are both important for BMD. We think that these are interchangeable, but not. Peak bone mass is different and bone loss is different. Calcium vitamin D index based on RDA is necessary for the maximizing peak bone mass. Desirable range of vitamin D is 20 to 40 nanogram per ml. Other nutrients include vitamin K, phosphorus, magnesium are important for the bone health. Combined supplementation of calcium vitamin D is recommended for the osteoporosis treatment, but no direct role for the treatment. Supplementation of the calcium vitamin D is not necessary for the primary prevention of osteoporosis. So it is actually palliative for pain relief, for euphoria, for good health, not for the prevention. Thanks. Thank you very much.